Hi, I'm Michelle Della Rosa, physical therapist at Connect PT. We treat such a wide variety of pelvic conditions at our facility. One of the common conditions that we treat relates to bowel dysfunction. Bowel dysfunction can be a main driver for why people have pelvic conditions. Bowel conditions can range from constipation, so not going very often, having painful bowel movements, having poor mechanics like straining, all the way to having bowel urgency, going too often, going too much, and everything in between. We work closely with physicians and recommend good diet, good food, because we know that good food is the best medicine to treat a lot of gastrointestinal and colorectal disorders. One of the techniques that we recommend is a bowel massage. A bowel massage is a hands-on technique that's very, very easy. People can do it on themselves, and you can treat constipation to bowel urgency. So I'd love to show you the technique, so let's get started. Lying down is a nice way to start learning how to do a bowel massage. A person can be mostly relaxed and the muscles are not really working, so they're relatively soft. It's important to remember how food enters our system and exits our system. So once you put food into your mouth, it goes down your esophagus and then goes into your stomach, sort of near your left lower rib cage. So it's about the size of a closed fist when it's empty. And then it moves into the convoluted small intestine, centrally located in this area. And then it moves into the large intestine, sort of as a picture frame for the picture of your abdomen. So what we're going to be working with is the large intestine. And the large intestine, the bowel massage can really be used for constipation or, like I said, like the bowel urgency, using the large intestine here. So if we locate our bony landmarks, it will help us as a reference point for where to start working. So if you locate your ribs here and here, your right lower ribs and your left lower ribs, and then locate your pelvis, they're bony so they're hard and you can feel them. So that's your right side and that's your left side. The large intestine moves from the right side all the way to the left side. So it's divided into different parts. There's the ascending colon, so that moves from your right pelvis all the way up to about your right lower ribs. And then there's the transverse colon, so that goes across this way from your right lower ribs to your left lower ribs. And then there's the descending colon, so that moves from your left lower ribs all the way down into your pelvis. So the way we perform the bowel massage, think of it as tracing the large intestine. So I start on the descending colon on this side, and I apply a gentle but firm pressure. Starting at about here, I grab the tissues and I come down all the way inside the left pelvis. Sort of like this. And I'm going to do that 10 times. People ask why I start at the descending colon, and it's really because if there's a backup somewhere along the system, I don't want to start at the beginning, because I might be adding to the backup. So I'll start here and making sure I get into this crevice inside the bone. And then I'll go over to the transverse colon. So pretend I did that 10 times. I'll go over to the transverse colon. So the transverse colon is in different places for different people. It could be right under the rib cage. It could be here. It could be here. But generally you're working from the right side over to your left side. So I'm just going to grab into these tissues, again with that firm but consistent pressure. It's not very deep, like I'm not poking into the person, and it shouldn't hurt really. So I'm coming across this way. All the way to the other side. And then I'm going to work, so that would be 10 times. And then I'm going to work on the ascending colon. So again, you're going to find your pelvis, come just inside and go all the way up to your right lower ribs. About 10 times. You could actually take a broader stroke here. Okay, so to review, we did down, over, and up. And you really could do this for yourself. Okay, so you could take the heel of your hand, okay, on and do the descending colon. Yep. Nice firm pressure. And you would do that the same 10 times. Okay, and then if you were to do the transverse colon, you could take your fingertips of the left hand and reach over to the lower ribs on the right side and just gently glide right across. Again, nothing should hurt. Everything should be fairly comfortable. In fact, should feel soothing. Okay, so let's pretend we did that 10 times. And then we're gonna do the ascending colon. So if you were to do it on yourself, you're gonna take your right hand, find that pelvic bone, reach inside, and glide all the way up nicely to your right lower ribs. You can do that 10 times. Usually I'll recommend doing the bowel massage one time, usually at nighttime, every night. Remember that we work together with the whole medical team, if the patient has other physicians, to use the bowel massage, food, diet, supplements, and medications if there are any, and any postural or hands-on work in physical therapy. If you have any other questions about how to help your bowel dysfunction, please call us at Connect PT or your local pelvic physical